I will kick it off here. Let's talk a little more in depth on the coronavirus. You mentioned in your statement that you're working together in a coordinating fashion with other entities that are trying to maintain the safety and well-being of so many citizens, and we are probably one of the most traveled countries, I'm sure, around the globe. I guess the first question I would ask is, when somebody is screened coming in, explain how that occurs. You mentioned to me earlier that it occurs actually at the airport of origin and not as that person is flying into the United States. Does TSA have a role there, and what is your role?
We do, Madam Chair. A couple things to answer that question. First and foremost, TSA, through its security directives and emergency amendments, provide requirements to carriers at all of the last known departure airports to the United States. So this is 280 airports throughout the world, not just airports in China. And essentially what we ask the carriers to do is ask a series of questions of every passenger as they're boarding. And they also have the option of checking the passenger's passport to ensure there's been no travel to China, for example, or now Iran for the last 14 days.
And there's two countries that are going to be added to that, correct?
There will be additional countries, I'm sure, as we continue to work with the task force, and I think those announcements will be relatively soon. So there's screening that's done by the carriers at the gate in last point of departure airports throughout the world. And then there's additional screening done by the passengers when they come into the United States, they cross the U.S. border. With respect to non-U.S. citizens, if you've been in China or Iran currently in the last 14 days, you cannot travel to the United States until 14 days has elapsed and you don't present symptoms of disease. But for U.S. citizens, you are allowed to return to the United States, but what we call funnel those passengers through 11 airports around the country. And at those 11 airports, the Centers for Disease Control does medical screening for the passengers as they present themselves at the border.
Do you feel like you have the resources and capabilities to complete this mission at this point?
I do feel we have the resources and the capability. This really has not impacted our domestic screening operations to date, and we have adequate equipment for our officers because, as you know, our officers wear gloves as a matter of course anyway. That's part of our requirement. Mm-hmm. That's the primary means of transmission for the disease. We've also authorized our officers in the screening checkpoints, if they would like to wear a surgical mask, they're permitted to do that, and we provide those masks.
Do you have any idea how many people have been denied entrance? Non-citizens? Is that a large number? Or?
It's not a large number, and then, of course, an even smaller number that present at the border and then are referred for further medical screening or quarantine.
Yeah. Let's talk about the real ID. I'm really concerned about this compliance. We all see the little sign that says by October 1st, you have to have the real ID, compliant ID. I told you earlier today that I did not realize that my driver's license is not compliant, although I thought that it was. And it has to have a gold star in the right-hand corner, which I checked a couple of times. This, to me, could really present to be a major nightmare for TSA. So how do you suggest, or how are you moving forward to making sure, and what are you doing with the states to make sure that people know that your life's going to change? And so I'd like to hear your explanation.
No, thanks for the question, Chairman. And we've done messaging for literally years on Real ID compliance. But what we find is that when we post messages at the screening checkpoints, people will generally just walk by them. They don't stop to read those messages. So that's not been the most effective means. And of course, we put all messaging on our website, but you have to go to the TSA website to receive it. What we did recently, beginning last August, was we asked our officers if a passenger presented him or herself at the screening checkpoint, provided their driver's license, and the officer noticed that that was not a Real ID driver's license, which is very easy to figure out because, like you said, it's got that gold star in the upper right-hand corner. The officer would say to the passenger, this license is fine for today's travel, and it's fine for travel all the way up to the 1st of October, but you will need to have a Real ID driver's license on the 1st of October of 2020. The other thing that we remind passengers of, and our messaging is very robust on this, is that there are other forms of acceptable ID in addition to a driver's license. For example, a passport is an acceptable form of ID. If you're a member of the military, your military CAT card is an acceptable form of ID. If you're a global entry trusted traveler enrollee and you have a card for global entry, that's an acceptable form of ID. We just need to remind people to remember to bring those other acceptable forms of ID, if they have them, to the checkpoint. Final thing, Chairman, that we're doing is we're working through the carriers, and the carriers have been terrific in helping us out with this, to post on their websites as a passenger is making a reservation. Hey, just remember that as of October, if you're making a reservation after October, you need to have to have a real ID driver's license. And then we will also ask them in the check-in process, as we get closer to 1 October, as a passenger goes to check in, that they provide that additional information. So the passengers that don't have them either bring something else that can get them through the screening checkpoint or change their travel plans.
Well, we want to work with you to be able to I just am envisioning, people have a tendency to put everything off. They wait till the last minute. You got to get 4 or 5 different types of ID to go in and get your real ID. And so we want to be helpful however we can. And so I will turn now to Senator Tester.